Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. And today's show is called Dr. Jeffrey Tauth Heart Murmurs Decoded for Patients. And trust me, it's juicier than your cousin's peach cobbler. You just heard heart murmur from your doctor and your mind is racing. But before you panic, let me tell you why most heart murmurs are actually your heart's way of saying, I'm working perfectly fine. Yep, entirely true. I can't make this stuff up. So what actually is a heart murmur? Think of it like this. If your heart were a fancy restaurant, a murmur would be the sound of the kitchen working perfectly well, just a little louder than usual. It's simply an extra sound your heart makes between beats, kind of like hearing water flowing through pipes, except it's just blood moving through your heart chambers. When I put my stethoscope on your chest, I'm listening for that telltale whooshing or swishing sound. And here's the kicker, most of these sounds are completely harmless, innocent murmurs, especially in kids and young adults. Their hearts are just announcing to the world, hey, look how efficiently I'm pumping. Now, there are two types you absolutely need to know about, and I promise this isn't going to turn into a boring medical lecture. First, we've got innocent murmurs, which are about as dangerous as a golden retriever puppy. They're harmless, often disappear as you get older, and need zero treatment. Think of them as your heart's way of showing off. Then there are abnormal murmurs, which might indicate underlying heart conditions that need some monitoring. The key difference? Innocent murmurs sound soft and actually change when you switch positions or start moving around. It's like your heart is saying, watch this cool trick. Only about 10% of murmurs in adults actually signal a heart problem worth investigating. 10%? That means 90% of the time you're worrying about absolutely nothing. Let me tell you about Sarah, a 28-year-old teacher who came to see me recently. She discovered her murmur during a routine physical, and I swear this woman spent the next 3 weeks acting like her heart was a ticking time bomb. She stopped exercising, couldn't sleep, and was probably Googling heart murmur at 2 in the morning like it was her job. Sound familiar? Maybe I should see you in the clinic. We need to talk. Anyway, we did a follow-up echocardiogram, and her heart function was absolutely perfect. Her murmur was completely innocent, just her heart being a little chatty. She's now back to running marathons with her cardiologist's blessing, and this story represents about 90% of the murmur cases I see. The other 10% get the attention they deserve, but most folks are worrying themselves sick over nothing. So when should you actually worry? Here are the red flags that make me sit up and pay attention. Chest pain, shortness of breath, dizziness, or fainting that happens along with the murmur. If you're experiencing any of these symptoms, your heart might actually be trying to tell you something important. Also, new murmurs that show up after age 40 deserve a closer look because let's face it, our hearts aren't 20 years old anymore. And if you've got a family history of heart disease, that changes how we approach the whole evaluation. It's like having a family history of bad driving, you just pay a little more attention to what's happening under the hood. If there's any genuine concern, your doctor will recommend an echocardiogram, which is basically an ultrasound for your heart. It's completely painless, takes about 20 minutes, and gives us a crystal clear picture of what's really going on in there. Here's your actionable takeaway, and I want you to write this down or at least remember it for your next doctor's visit. If you have a murmur, ask your doctor these two simple questions. Is this innocent or abnormal? And do I need any activity restrictions? Then, and this is crucial, follow their guidance, not your anxiety. Your doctor went to medical school for this stuff. Google University doesn't count. Trust me on this one. The bottom line is this. Heart murmurs sound scary, but they're usually about as concerning as your stomach growling when you're hungry. It's just your body doing what bodies do, sometimes a little louder than expected. Don't let a harmless murmur turn you into a cardiac hypochondriac, but don't ignore genuine symptoms either. Know the difference, ask the right questions, and get back to living your life. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.